My name is Albert Figueras, and I'm the domain director of entitled Medicines and Public Health. We used to think about medicines as something that is taken by a patient and something that produces a beneficial effect on this patient. We also know that sometimes medicines produce side effects on patients. But in fact, just seeing the complex world of medicines from this point of view is like trying to see the ball just with one eye. And I think that it's important to see the vision that offers the other side. And the other side refers to the great number of available medicines that are marketed worldwide. And also it refers to the access of the population to these medicines. Medicines, of course, involve money, involve a lot of money, and it's important to know the cost of the treatments. And it's also important to know the medicalization of society. Our lives, our society, are over-medicalized. So it's important to have also this point of view. And this is what we will try to discuss in this module, Medicines and Public Health. The main objectives of this module is to provide intermediate and advanced knowledge on the effects of medicines from the public health point of view, and also to develop theoretical and practical knowledge of the quantitative and qualitative analysis of medicines utilization everywhere, in your hospital, in your country, medicines produced by your drug company, and so on. And finally, and the last objective of this domain is to know how to study the health and economical impact of these side effects of medicines for the community. There are a lot of examples. In your domain, we will see, of course, theoretical examples, but one important part of the domain is the practical side. I mean, in this domain, you will work with a specific drug utilization study design. You will prepare your own protocol. And you can see the results of some of these protocols. For example, we studied the National Drug Formulary and the package inserts of different medicines in Trinidad and Tobago. This was one of the master theses read. And also another colleague was interested in how medicines were used in children that go to an outpatient department in a hospital in Kabul, Afghanistan. And he also found interesting results. Another colleague was interested in how medicines were used by pregnant women that were controlled in a Pakistani hospital. He studied this aspect, and she also had different interesting conclusions. It is possible to try to analyze or to design studies to try to analyze how medicines affect or interfere with different diseases and which factors alter the benefits of these medicines. For example, a study was carried out in a hospital in Kenya where the factors associated with reduced efficacy of anti-malarial drugs were analyzed. These people find, for example, that vomiting is an important factor associated with less efficacy of these drugs. And it is important to know this in order to prevent these effects or in order to improve the efficacy. And what happened with traditional medicine? It was carried out a study in different markets of Port-au-Prince in Haiti in order to identify different syrups that were marketed and were used by the population for different symptoms, such as, for example, urinary tract infections. These are important diseases, and sometimes these diseases are treated with medicines with a composition that is not really known. So, in this domain, you will have the opportunity to study all these questions and much more. This domain is given by people, professors that are working at the Autonomous University of Barcelona. That's an academic partner of Eu2P. And part of these professors are also working at the Catalan Institute of Pharmacology, that is a collaborating center of the World Health Organization for research and training in pharmacoepidemiology. So I think that I try to communicate you the importance of public health, medicines, money, and the need to try to study or try to consider all these elements for the future. Thank you.